Thank you for your time today. My name is Natsuko Hatano. I was a master student, MIPH course 2015 and 2016. Today I'm going to present about my thesis titled Exploring Possibilities of Integrated Health Promotion for Female Genital Schistosomiasis and Sexual and Reproductive Health. This is a case study in rural Ghana. So here is the outline of my presentation, starting from background to aim, objective, method, and at the end conclusion. Well, so background. Schistosomiasis, as you know, it's a waterborne disease caused by parasitic worms, and in some countries like China or Egypt, it's been a successful program in eliminating schistosomiasis before, and according to some literature, health promotion is one of crucial intervention combined with other approaches, including, of course, drug administration. And about female genital schistosomiasis, this is the area where there is little attention to its research, understanding, and social awareness. There are many clinical studies about this particular schistosomiasis with women. According to some studies, there is a clinical association between female genital schistosomiasis and sexual and reproductive health, such as infertility and increase in risk of getting HIV. So with this background, I argue that there are possibilities of including strategies for female genital schistosomiasis control in sexual and reproductive health program. And if you look at the context in Ghana, this is one of the high endemic countries in West Africa, and according to reports by the government, all regions are endemic. It's said to be, the prevalence is said to be 83% of all districts. So if you look at the map, you can see here the different colors, but these are more, this orange part, these are highest, it says 60% and above the prevalence. And this is the area where lake water is located. And around here, as you can compare, the endemic prevalence is pretty high. And also, one of key of my research is focus on rural area, because people in rural area are likely to be exposed with this infection, because of their living environment. So according to the demographic survey, compared with urban area, in rural area, people are likely to more likely to use non-improved water source for drinking, and likely to use non-improved sanitation facilities at the rate of almost 46%. So there are this this disease can get through contaminated water sources, and with this figure, in rural areas, people are having a higher risk. And if when I look at the previous policy for 5 major NTDs, neglected tropical diseases, Ghana health system really has potential for integration between different disease programs. This shows 4 main areas that I found quite relevant when we think about integration between vertical disease programs. For example, Ghana health system is based on the principle of integration in service delivery and management, and there is also a focus on collaboration work between different NTDs, aiming to control efficiently through comprehensive approach rather than doing a single disease focused program. Also, to an extent, there is a foundation for health promotion in Ghana, looking at their material resources, for resources and experience in general for health promotion. And they also, to an extent, they're experienced in improvement of water and sanitation facilities because of previous program for Guinea war and these sort of infectious diseases. And in terms of research, there is a knowledge gap in relation to integration for female genital schistosomiasis. Studies on schistosomiasis in Ghana are mostly clinical findings, and other studies involved integration of different types of intervention or distribution of multiple drugs for other tropical diseases such as onchocerciasis and lymphatic filariasis. So this when they are talking about integration, it's not it's within the NTD program or collaboration of different methods. Also, when I did the literature review, there was one study similar to the topic I was talking about, the integration. That is integration of schistosomiasis, looking at the possibility of integration of schistosomiasis screening with human papilloma virus vaccination program for adolescents. But with this study, it doesn't focus on women in particular, nor looking at integration between female genital schistosomiasis and other disease categories. So I argued that there is a lack of knowledge about integration in health promotion with sexual and reproductive health and perception of women, considering their perception and experience. So that's why I conducted qualitative research in Ghana, in rural Ghana. The aim of my research is to identify to what extent integrated health promotion messaging for female genital schistosomiasis and sexual and reproductive health would be accessible and acceptable to women of reproductive age, precisely defined as between 15 and 49 years old, in the rural area of Greater Accra region in Ghana. And this is, sorry about the lot of information, but basically my research contains 4 main objectives, as you can see here, and to explore opportunities for integrated health promotion regarding FGS and SLH as abbreviation. I conducted first literature review, as I explained so far, and also I interviewed health service providers, as well as to explore the perception and understanding of FGS among women of reproductive age, and to elucidate the method for health promotion preferred by them. I did 2 different types of qualitative research, in-depth interviews and focus group discussions. And through analysis of these primary data and comparison between primary data and secondary data, I tried to identify key strategies for the delivery of integrated health promotion at the community level. So my fieldwork took place between 17th June and 22nd July, about 6 weeks, and study site was in 6 communities in one district in Greater Accra region, as I said. I anonymized the name of communities due to few number of health staff in each health facility I visited. So for privacy and consent issues, I didn't put the detail about the community name. And this is the location, the picture of the location where focus group discussion took place, near the lake water. Methods involves purposive sampling, and after finding the participants, the research team went through consent and assent, and did interview or focus group discussions, and I used framework analysis. Results. Now this shows the background of all the participants participated in this study. So one from Ghana Health Service representative responsible for NTD program, and 2 from district manager levels, and 4 from community health facilities as healthcare workers. And this women of reproductive age in the same communities are large in group, because my focus is this group. So here is the result, depending on each objective. So to explore perceptions and understanding of FGS among women, the interview question contained first their question about their water resource use. So many women mentioned various types of water sources available in communities, but mostly they tend to rely on river water for various purposes of household chores, such as bathing, washing, and drinking. And reason for using river water also varies. Financial matters, a lack of other sources, and problem with the tap water, which means limited access to to tap water. Particularly in this area, people mentioned, participants mentioned that even though they have shared tap or tap water running in the community, sometimes it's been cut it off unexpectedly and frequently. So one farmer aged 45 years old said they, as referred to people in general, like closing it too much. Sometimes at weekends like today, they can choose to close it up to 5 p.m. before they open it, and within a short time they close it again. So the water source is closed, safe water source is closed, but there are some difficulty to access to these sources. And also it was interesting to find out that there was strong sense about dirty river water among focus group discussions. This river water seen as contaminated by outsiders. In their words, there are a lot of excreta in the river since the white people have connected the manhole into the river or by the machine that we could see in the river, in the middle of the river, which made the water muddy and reddish. So borrowing their words, referring to their words. In terms of their knowledge or understanding about female genital schistosomiasis, there was general awareness towards schistosomiasis, but not much towards FGS. So the team decided to use body ruling to describe schistosomiasis because we didn't find local term identical with this disease. So that this methodological issue might affect their responses, but however the main response, first response when we asked about this disease, it often about body wearing, painful urination, and abdominal pain. These are main responses coming up. And in terms of causes, they were also aware of the use of river water as a cause, and often for bathing and swimming. And even some women mentioned parasitic worms in the river lake water, the parasitic worm that carry the disease. So they describe as tiny insect or little organisms, but they were quite aware of this schistosomiasis, but not much about FGS, like infertility or any sexual or reproductive health issues really didn't come up. And there was in terms of health-seeking behavior, there was a health promotion messaging going around that if you find these symptoms, you should come to health facilities. But women often mention a lack of money to get there, or they couldn't afford for the drug after being diagnosed. And then in terms of prevention, because it was quite some people were familiar with the causes, the river water, so they were willing to avoid the sources or treat water to purify it before using. However, this also comes with resource issues like money and means to purify. And lastly, this in terms of chemotherapy for prevention, there were both positive and negative responses. Positive one was before attending mass drug administration, they were well informed what's going on and about the drug by community health nurses. However, some people experienced that they didn't get enough attention from people who delivering these services or doctors. That there was a lack of explanation about the purpose of this drug administration. Well, they didn't have any problem or obvious symptoms, and it's often because mass drug administration often focus on school-age children. So this mature woman expressed this is something happened in childhood or event for children. So community as a whole couldn't get benefit from it. And as I said before, there are issues of limited access to improve water resources and healthcare for schistosomiasis because of a lack of follow-up after being tested. Some women said doctor came to this community to test us whether they are infected, but they never come back to see to tell the result. Or yes, the other is a lack of money to buy drugs. So the feeling, when we ask about the feeling about these messages or information about schistosomiasis, some women expressed useful or happy to know because they wanted to know to see they really needed to get some support from health staff or somebody in the community. And some mentioned the pressure to learn new things. It health matters to these people. But the other negative response was it was that difficult to accept such messages, like come to stop using the river water because their livelihoods really rely on the river water, the limited with these limited resources in communities, and concern was there is other different perspective that women themselves could understand and contribute to stop using, but there are some people in the community. For example, people engaged in fishing or children who don't pay much attention as adults to river water, risky river water. Women express concern towards others that these people can't really stop using it. And in terms of method, health promotion method, health workers actually actively engaged in health education on schistosomiasis through various types of methods. For example, in terms of places, they used health facilities when patients or people, community members visit, as well as lots of places in communities. They often use health visit, home health visit to school or home individually, and they also gather the community members to one place and deliver the health talk, have a health talk session with other themes. So actors were often community health nurses as major actors. Others could be healthcare professionals, teachers, and or community volunteers. But those actors who were accepted widely by communities and the common view among healthcare providers were really community health nurses. They were the people most close to the women or people in communities, and they said that they used educational materials or radio program or oral presentations. Even they go to churches or mosques to deliver a talk. However, it's really unfortunate, or it's really the issue about methods is that they lack materials, educational materials, especially about schistosomiasis. One manager said they saw materials 2 years ago or 1 year ago when there was mass drug administration. And preferred methods by women interviewed involved different types of for receiving the messages related to tool, place, timing, and frequency. I mean, they were requiring more opportunity to be educated, and some women preferred group gathering because in that way they could engage in discussion and they could talk with others. But in other cases, a woman mentioned she preferred individual sessions, one-to-one, because she could ask her personal question easily. And also in terms of timing, because they're looking after children, taking household chores, or many women work at farm or other places, so there was a demand for the less busier time and frequent visit for health education. In terms of integration between FGS and SLH, first there was not much linkage between FGS and SLH when service providers were interviewed. The closest or similar response in terms of this theme was that some community health nurses said sometimes schistosomiasis can be confused with sexual transmitted infections or diseases. So when they have a talk with people in communities, and when they recognize it's confused, they make a differentiation between schistosomiasis and sexually transmitted disease. But otherwise, I didn't hear the response for infertility or HIV and AIDS. And however, all service providers had a willingness to implement integrated health promotion. One district manager strongly expressed that it would be very good to integrate the two. Every woman is concerned about their private tract reproductive health. So if you integrate it, it would be so easy for them to understand the importance of preventing schistosomiasis. So there was a willingness, and actually in the national level, from representative of NTD program, I heard the response that the ministry within Ministry of Health, there is the information passing about female genital schistosomiasis with family health planning department or other similar sectors, but there was not much policies or actual practice to integrate these two was not going on. In practice, nevertheless, in practice, community health worker engaged in health education on schistosomiasis in relation to SLH services in community level. So they take chances when they provide services for reproductive health issues. They seem to talk. They try to talk about schistosomiasis, educate them how to prevent or how they can seek the services. However, the issues entails a shortage of praziquantel, the drug, and health promotion resources, as I said, materials. And there was a requirement of the development of policies and educational materials for integration at the top level. So in my discussion, I said I argued that there is the recognition of FGS was very limited, particularly among the women, and challenges to the prevention treatment. One of the challenges is the use of water resources when women try to stay away from freshwater resources or access alternative sources. And the other challenge is the absence of continuous medical support, as I show some findings. And lack of health service providers mentioned a lack of drugs at facilities. So when they have shortage of drugs, they had to advise their patients to, they prescribe, but they advise them to go to pharmacy or shops to get the drug. But often people could not afford these health services and drugs. And the current program on schistosomiasis need to be strengthened in a way that the community perspective found in this research are reflected, and the messages are more realistic to women in communities living with multiple daily tasks and poverty. And also at the same time, health service provider need to ensure regular supply of drugs. And I found that there are certainly opportunities for integration. There was enthusiasm at the national level, as well as willingness to implement at the district level. However, there is a potential challenges such as how to avoid an increase in the stigma of FGS by integrating this particular disease with sexual and reproductive health. Now it gets popular to deliver services of HIV and tuberculosis because of the co-infection. Many cases in African countries, but one study was focusing on the perspective of healthcare providers about stigma or social discrimination by integrating HIV and TB in Ghana. So we need to be careful not to stigmatize these people by integration. And I showed a couple of models for integrated health promotion based on my finding. So this first box represents impractical ways of approaching of addressing schistosomiasis, like do not use the messages like do not use the liver water or come to the clinic, but these seem to be impractical for poor and busy women. Alternative could be messages concerning sexual and reproductive health of women and appealing to their care towards others, I mean children, family and community members, as it was felt by participants, or as key actors of delivering these integrated health promotion messages. I think community health workers can be intermediaries between community members and health facilities, because they already in a good position to communicate and link these two sides very well. And this model is based on the response from district managers. So they really require the changes in the top level, Ministry of Health, in terms of planning and development of integration. So starting with policies for integration, development of health promotional materials and activities, and if these are developed and put in down to regional to district level, then they could have trainings on district staff with these developed materials. And so this is just a idea of how we can develop from national to district level. In my conclusion, there is a need for integrated health promotion for female genital schistosomiasis with sexual and reproductive health services in rural communities in Ghana. However, more supports and resources are required at the national level. The integrated health promotion can be effective and can respond to the demand of women, but we need to establish a program that is responsible to the realities of communities. These female women of reproductive age expressed. So this is the end of my presentation. Thank you very much for listening, and thank you so much for all the people who participated in this research.